Bismillahirrahmanirrahim. This is a talk about anaphylaxis by Dr. Wassefy, lecturer of clinical pathology, immunology. What's anaphylaxis? It's a recognition and treatment. It's recognition and the treatment. We must know the definition of anaphylaxis, the antigens of anaphylaxis, what happens during anaphylaxis, and recognition of signs and symptoms of anaphylaxis, what's the treatment of anaphylaxis, and how to do a follow-up care and management of a client with anaphylaxis. We mean a patient with anaphylaxis. Anaphylaxis is a severe, life-threatening, generalized, or systemic hypersensitivity reaction characterized by rapidly developing life-threatening and or breathing and or circulatory problems usually associated with skin and mucosal changes. What are the antigens? The antigens commonly impacted in anaphylactic shock include medications such as stings, nuts, shellfish, milk, eggs, penicillin, AC inhibitors, non-steroidal anti-inflammatory drugs, aspirin, anesthetic drugs, and latex. Those are the common antigens or allergen which stimulates the anaphylactic reaction. The clinical signs and features of anaphylaxis, it may come through skin contact by poison plants or animal scratches or pollen or latex, some sort of injections like bee sting, or medications, also nuts and shellfish, also inhalation of pollens or dust or molds or animal dander. Those common allergens precipitate a type 1 hypersensitivity reaction. The antibodies formed upon initial exposure to a foreign antigen, which is usually immunoglobulin E. The antigen triggers release of vasoactive amines and mediators that act on the vascular and the pulmonary system. Here are a couple examples of the anaphylactic antigens, the antigens producing anaphylaxis. The reaction here, at first we said that there is an initial exposure by which there is a stimulation of formation of immunoglobulin E, which is going to settle over its epsilon Fc receptors on the surface of mast cell and basophil. Those cells are granule cells. Their granules contain histamine and other vasoactive amines and platelet activating factors and a lot of factors which stimulates the reaction. Once histamine release, it will cause pruritus by desensitizing the nerve endings and edema and urticaria through dilatation and increasing the permeability of the blood vessels. Also, the vast quantities of histamine release may lead to vascular collapse and respiratory failure. The onset of anaphylaxis is usually sudden, within minutes of exposure to an allergen. A minority of patients may suffer a few second attack in response to penicillin and contrast agents and others after insect sting too. Here is the 4 types of hypersensitivity reaction. The type here involved in the anaphylaxis is type 1, by which here the allergen is going to be formed at first, is going to be induced at first to stimulate the production of immunoglobulin E. This is the first exposure. This immunoglobulin E will settle, as you can see here, over mast cell or basophil, which is a granular cell containing histamine and the mediators which are going to be released during the second exposure to the same allergen, and a process of capping of this immunoglobulin E over the surface of the granulated cells will lead to its degranulation and releasing of the granular component, leading to activation of anaphylaxis. This anaphylactic reaction, as we see here, the process of formation of immunoglobulin E at first, then the process of degranulation and releasing of vasoactive amines, causing their effect over blood vessels or airways according to the mode of ingestion of the of allergen, if it was injected or inhaled or come in contact with the skin or whatever. Also, it may lead to effect on the blood vessels and cellular infiltration. The clinical effects may be hay fever or asthma or eczema or anaphylaxis. Here is the process by which there is at first initial allergen encounter to produce immunoglobulin E and the capping of this and the presentation of this immunoglobulin E over the surface of mast cell. Then in the second exposure, degeneration occur and the clinical symptoms will appear. How do I know that the patient has an anaphylaxis? It's characterized by its sudden onset and rapid progression of symptoms. It's a life-threatening, by which it affects airway or breathing or sometimes circulatory problems, skin and mucosal changes like flushing and urticaria and angioedema. There is often a history of anaphylaxis or severe allergic reactions, but it may be the first exposure to the allergen and the first presentation. The symptoms may be respiratory, cardiovascular, or cutaneous, or gastrointestinal, or neurological according to the dose and the mode of entrance of the allergen. Here is a science for the person with anaphylaxis in order to save his life, by which someone is having a peanut allergy, so he's wearing something to alert the ER doctor for the problem that he's facing, and also he may have auto injection himself with the life-saving medications. There is a differential diagnosis by which it may asthma and urticaria and angioedema and vasovagal episodes, and also acute anxiety and pulmonary embolism and foreign body aspiration may come in differential diagnosis with the process of anaphylaxis. Resuscitation guidelines are here in this link. You may just for further information, you may use this link for further information. Thank you.